On that first day, we talked about certain things, about what I'm doing and how I got pregnant and when I got pregnant, and we just had some kind of bond.
I don't want to say it was a bad choice because, I was blessed with a beautiful son, but it was a choice that could have been thought out a little bit more.
LA Best Babies Network, working together for healthy babies and a healthy future.
Having a healthy pregnancy and having a healthy child begins well before pregnancy.
We're trying to screen for things, look for them, take care of them, so as to safeguard the health of the mother as well as the fetus and the baby.
And we do it, with grace and with love and with perseverance and with commitment.
Los Angeles County is the most populated county in the nation with approximately 10 million residents. But nearly 1.8 million of these individuals and families live below the poverty level.
Stress and poor nutrition affects the developing brain and organs of the unborn child. This is what patterns the risk of disease later on in life.
Prematurity and low birth weight also cause developmental and neurological problems, learning disabilities, and social and emotional problems. But LA Best Babies Network is demonstrating that positive change is possible. The network focuses on 5 interrelated strategies to help create a healthier future for newborns and their families.
If we provide the right care and the resources, we can prevent many of the complications in pregnancy, birth, or even in that first year of life.
If you can engage a mother when they're pregnant, they're most receptive to information and education.
To, again, look at all of the factors that contribute to birth outcomes, from nutrition to mental health issues, to actual medical care and services.
We talk about so many different things because we need to know that whatever service she needs, we can get it for her.
And we provide resources, so if there are things that the mothers are needing, for instance, finding housing, sometimes employment for the father of the baby, we have food resources that we bring to them.
Before the network was formed, there wasn't a real focus on quality improvement in perinatal care.
Quality care really refers to providing the kind of healthcare, which is tests and health education, that have been shown to be effective through research studies.
The network also works to ensure that women and their families play an active role in their own care by participating in self-management support.
The doctor's not going to be able to go home with you, check what you're eating, make sure you take your medications on time, make sure you exercise, and so on and so forth.
I notice when I do the yoga, if I come in with high blood sugar, by the time I leave out, it's gone down really low. So I know that's working for me.
What we're seeing is that those education and exercise classes are as impactful on the blood sugar levels of our diabetics as medication.
The network also provides a standard of comprehensive perinatal care that respects every family's cultural background.
Being respectful of different beliefs and attitudes that individuals bring to the healthcare setting and respecting those as important contributors to how they're going to manage their own healthcare.
Depression, during and after pregnancy, is a condition faced by many women that is often underdiagnosed and undertreated.
We know that children who are abused or neglected, a lot of times they are at the hands of the mothers, and those mothers are depressed.
She did mention to me she had an actual plan, to hurt herself. And when I asked her what was her plan, she wanted to get a kitchen knife and stab herself.
We're having a big improvement in screening for depression during pregnancy and also postpartum. And that's something that most of the clinics weren't doing at all.
The Healthy Births Learning Collaboratives provide a forum where perinatal caregivers and advocates meet to share knowledge, keep current on best practices, and coordinate strategies and solutions. This collaboration is serving as a model for communities nationwide.
Organizations want to participate, one, because it is extremely valuable, low cost, and allows them to introduce strategies in their clinical sites that we know will benefit families.
The sharing of knowledge and resources is critical in broadening the network's reach and is the very essence of collaboration.
It's looking for another agency that has a specialty that your client needs and building that relationship with that agency so that you can have a seamless referral.
Whether it is sharing with them evidence-based practices that exist, whether it's quality improvement tools, what are the best practices when it comes to implementing home visitation.
A key policy issue has been preconception health, the time before a woman becomes pregnant, and interconception health, care between pregnancies. Currently, low-income women who qualify for pregnancy-only Medi-Cal lose this publicly funded coverage shortly after birth, at the very time they and their babies need it most.
They have no way of addressing those health issues for the next pregnancy, and the chances are that they'll have a second adverse birth outcome in that next pregnancy.
And so you have this kind of seesaw of services and service gaps that result from this kind of a health financing arrangement.
The network is collaborating with more than 100 partner organizations to reshape the future of perinatal care through policy reform at the local and national level.
I do believe we have reduced the complications, reduced risks for families, but we've also institutionalized some of these strategies within these clinical sites.
And the network is preventing many long-term problems currently afflicting society.
Helping the child be more ready for school so that they're more successful in school, decreasing school dropout rates, decreasing juvenile justice and later criminal justice involvement.
You know, this is the benefit, this is the cost.
The goal would be to increase the penetration of the services and expand services so that we meet a larger proportion of the population.
Of all the network's accomplishments, the direct impact on the lives of mothers and their families is the most gratifying.
She's very determined, and I think that she's going to do very well.
I am working on my master's in education. I attend the University of Phoenix one night a week. Hopefully I'll be in the classroom teaching again.
She is more determined than ever to be the best mom, the best grocery clerk, the best student, the best mate. She's really very responsible. I think she always had that in her, but I think the program's brought it out in her.
I wasn't going to be able to become a doctor or none of that, but now I see more that I can do it. It's going to be harder, but I know I can.